121. What is the priority nursing action for a patient with a new onset of seizures post-stroke? Answer: administer prescribed anticonvulsants and ensure safety. Rationale: seizures risk injury. Anticonvulsants and safety measures prevent harm, per AHA stroke guidelines. 122. What should the nurse monitor in a patient receiving enteral nutrition? Answer: monitor for aspiration and residual volumes. Rationale: enteral feeding risks aspiration and overfeeding. Monitoring ensures safety, per Aspen nutrition guidelines. 123. What is the nurse's first action for a patient with a new onset of fever and sepsis? Answer: administer prescribed antibiotics and obtain blood cultures. Rationale: fever and sepsis indicates infection. Antibiotics and cultures treat and identify the source, per Surviving Sepsis campaign guidelines. 124. What should the nurse assess in a patient with suspected pyelonephritis? Answer: assess for flank pain and fever. Rationale: pyelonephritis causes kidney infection, leading to pain and fever. Assessment guides antibiotic therapy, per IDSA guidelines. 125. What is the priority nursing action for a patient with a calcium level of 7.5 milligrams per deciliter? Answer: administer prescribed calcium supplements and monitor for tetany. Rationale: hypocalcemia, less than 8.5 milligrams per deciliter, risks neuromuscular irritability. Supplements and monitoring prevent complications, per clinical electrolyte standards. 126. What should the nurse include in teaching for a patient with a new tracheostomy tube? Answer: suction as needed and humidify inhaled air. Rationale: suctioning clears secretions and humidification prevents mucosal drying, per American Association for Respiratory Care guidelines. 127. What is the nurse's first action for a patient with a new onset of chest pain and pulmonary embolism? Answer: administer oxygen and notify the provider. Rationale: chest pain indicates hypoxia. Oxygen and notification ensure anticoagulation therapy, per AHA guidelines. 128. What should the nurse monitor in a patient receiving prednisone for rheumatoid arthritis? Answer: monitor for hyperglycemia and osteoporosis. Rationale: prednisone causes elevated glucose and bone loss. Monitoring prevents complications, per ACR guidelines. 129. What is the priority nursing action for a patient with a new onset of confusion and cirrhosis? Answer: administer prescribed lactulose and notify the provider. Rationale: confusion indicates hepatic encephalopathy. Lactulose reduces ammonia and notification ensures treatment, per AASLD guidelines. 130. What should the nurse teach a patient about preventing pressure ulcers post-hip fracture? Answer: reposition every 2 hours and maintain skin hygiene. Rationale: immobility increases ulcer risk. Repositioning and hygiene reduce pressure, per National Pressure Injury Advisory Panel guidelines. 131. What is the nurse's first action for a patient with a new onset of shortness of breath post-cholecystectomy? Answer: assess respiratory status and notify the provider. Rationale: shortness of breath may indicate atelectasis or embolism. Assessment and notification ensure timely intervention, per surgical care standards. 132. What should the nurse assess in a patient with suspected Crohn's disease flare? Answer: assess for abdominal pain and weight loss. Rationale: Crohn's flares cause inflammation, leading to pain and malnutrition. Assessment guides therapy, per Crohn's and Colitis Foundation guidelines. 133. What is the priority nursing action for a patient with a magnesium level of 3.0 milliequivalent/L? Answer: notify the provider and withhold magnesium supplements. Rationale: hypermagnesemia, greater than 2.2 milliequivalent/L, risks respiratory depression. Withholding supplements and notification prevent worsening, per clinical electrolyte standards. 134. What should the nurse include in teaching for a patient starting metformin? Answer: take with meals and report nausea. Rationale: taking metformin with meals reduces GI upset, and reporting nausea ensures management, per ADA guidelines. 135. What is the nurse's first action for a patient with a new onset of hematuria post-nephrectomy? Answer: assess urine output and notify the provider. Rationale: hematuria may indicate bleeding. Assessment and notification ensure timely evaluation per AUA guidelines. 136. What should the nurse monitor in a patient receiving warfarin for atrial fibrillation? Answer: monitor for bleeding and INR levels. Rationale: warfarin increases bleeding risk and requires INR monitoring for therapeutic levels per AHA anticoagulation guidelines. 137. What is the priority nursing action for a patient with a new onset of fever in endocarditis? Answer: obtain blood cultures and administer prescribed antibiotics. Rationale: fever indicates infection. Cultures and antibiotics target the pathogen per AHA endocarditis guidelines. 138. What should the nurse assess in a patient with suspected transient ischemic attack? Answer: assess for transient weakness and speech difficulty. Rationale: TIA causes temporary neurological deficits. Assessment guides antiplatelet therapy per AHA stroke guidelines. 139. What is the nurse's first action for a patient with a new onset of redness at a surgical site? Answer: assess the wound and notify the provider. Rationale: redness may indicate infection. Assessment and notification ensure timely antibiotics per CDC infection control guidelines. 140. What should the nurse teach a patient about managing chronic kidney disease? Answer: limit phosphorus intake and monitor for edema. Rationale: CKD impairs phosphorus excretion and fluid balance. Dietary limits and monitoring prevent complications per NKF guidelines. 141. What is the priority nursing action for a patient with a new onset of wheezing and asthma? Answer: administer prescribed albuterol and assess response. Rationale: wheezing indicates bronchoconstriction. Albuterol relieves symptoms and assessment guides further therapy per GINA asthma guidelines. 142. What should the nurse monitor in a patient receiving ceftriaxone for pneumonia? Answer: monitor for allergic reactions and liver function. Rationale: ceftriaxone risks hypersensitivity and hepatotoxicity. Monitoring ensures safety per IDSA antibiotic guidelines. 143. What is the nurse's first action for a patient with a new onset of confusion post-hip replacement? Answer: assess oxygen saturation and notify the provider. Rationale: confusion may indicate hypoxia or fat embolism. Assessment and notification ensure timely intervention per orthopedic nursing standards. 144. What should the nurse assess in a patient with suspected appendicitis? Answer: assess for rebound, tenderness, and fever. Rationale: appendicitis causes peritoneal inflammation, leading to tenderness and fever. Assessment guides surgical planning per American College of Surgeons guidelines. 145. What is the priority nursing action for a patient with a sodium level of 152 milliequivalent/L? Answer: administer prescribed hypotonic fluids and notify the provider. Rationale: hypernatremia greater than 145 milliequivalent/L risks neurological damage. Hypotonic fluids correct sodium, and notification ensures monitoring per clinical electrolyte standards. 146. What should the nurse include in teaching for a patient with a new implantable cardioverter defibrillator? Answer: avoid heavy lifting and report shocks. Rationale: heavy lifting risks lead dislodgement and shocks indicate arrhythmias per AHA device guidelines. 147. What is the nurse's first action for a patient with a new onset of chest pain post-myocardial infarction? Answer: administer prescribed morphine and notify the provider. Rationale: chest pain indicates ischemia. Morphine relieves pain and notification ensures evaluation per AHA guidelines. 148. What should the nurse monitor in a patient receiving levothyroxine for hypothyroidism? Answer: monitor for palpitations and weight loss. Rationale: levothyroxine overdose causes hyperthyroidism symptoms. Monitoring ensures safety per Endocrine Society guidelines. 149. What is the priority nursing action for a patient with a new onset of fever in pyelonephritis? Answer: Obtain urine cultures and administer prescribed antibiotics. Rationale: fever indicates kidney infection. Cultures and antibiotics target the pathogen, per IDSA guidelines. 150. What should the nurse teach a patient about preventing infections post-splenectomy? Answer: receive vaccinations and report fever immediately. Rationale: splenectomy increases infection risk. Vaccinations and fever reporting prevent sepsis, per CDC guidelines. 151. What is the nurse's first action for a patient with a new onset of seizures and eclampsia? Answer: administer prescribed magnesium sulfate and ensure safety. Rationale: seizures risk maternal and fetal harm. Magnesium sulfate and safety measures prevent injury, per ACOG guidelines. 152. What should the nurse assess in a patient with suspected pneumothorax? Answer: assess for absent breath sounds and chest pain. Rationale: pneumothorax causes lung collapse, leading to absent sounds and pain. Assessment guides chest tube placement, per American Thoracic Society guidelines. 153. What is the priority nursing action for a patient with a potassium level of 6.2 milliequivalent/L? Answer: administer prescribed insulin and glucose and notify the provider. Rationale: hyperkalemia, greater than 6.0 milliequivalent/L, risks arrhythmias. Insulin/glucose shifts potassium, and notification ensures treatment, per AHA electrolyte guidelines. 154. What should the nurse include in teaching for a patient with a new colostomy? Answer: monitor stoma color and empty the pouch when 1/3 full. Rationale: a pink stoma indicates health, and timely emptying prevents leakage, per Wound, Ostomy, and Continence Nurses Society guidelines. 155. What is the nurse's first action for a patient with a new onset of chest pain in aortic aneurysm? Answer: administer prescribed antihypertensives and notify the provider. Rationale: chest pain indicates aneurysm expansion. Blood pressure control prevents rupture, per AHA guidelines. 156. What should the nurse monitor in a patient receiving hydromorphone for postoperative pain? Answer: monitor for respiratory depression and constipation. Rationale: hydromorphone depresses respiration and slows GI motility. Monitoring ensures safety, per ANA pain management guidelines. 157. What is the priority nursing action for a patient with a new onset of shortness of breath in COPD? Answer: administer prescribed bronchodilators and oxygen. Rationale: shortness of breath indicates bronchoconstriction. Bronchodilators and oxygen improve airflow, per GOLD guidelines. 158. What should the nurse assess in a patient with suspected diverticulitis? Answer: assess for left lower quadrant pain and nausea. Rationale: diverticulitis causes inflammation, leading to pain and nausea. Assessment guides antibiotic therapy, per American College of Gastroenterology guidelines. 159. What is the nurse's first action for a patient with a new onset of fever in a wound infection? Answer: obtain wound cultures and administer prescribed antibiotics. Rationale: fever indicates infection. Cultures and antibiotics target the pathogen, per CDC infection control guidelines. 160. What should the nurse teach a patient about managing hypertension post-discharge? Answer: exercise regularly and monitor blood pressure. Rationale: exercise and monitoring reduce blood pressure, preventing complications, per AHA hypertension guidelines.